Can I have both Medicare and VA benefits? Imagine having two powerful tools to help you stay healthy and cared for. Many veterans wonder if they can use both Medicare and Veterans Affairs benefits at the same time. The answer is yes, you can. This is often called being dual eligible, but that term usually refers to Medicare and Medicaid. For veterans, having both means you can choose how to get the care you need from each program. Medicare is a federal program mainly for people aged 65 and older or those with certain disabilities. Veterans benefits are provided by the Department of Veterans Affairs for eligible veterans. These two programs do not replace each other. Instead, they work side by side to cover different types of health services. When you have both, you can pick where to get your care. For example, you might use VA facilities for health issues related to your military service. For other health needs, you can go to Medicare-approved providers outside the VA system. You are not required to stick with just one. Having both gives you more options and flexibility. Medicare and VA benefits do not coordinate in the same way as Medicare and other insurance plans. Each pays for its own services. The VA usually covers care at VA clinics or hospitals and through VA-authorized community providers. Medicare covers care from approved providers outside the VA. If you go to a non-VA doctor or hospital, Medicare may be your main coverage, especially for non-service-connected conditions. For health issues related to your military service, the VA is typically the primary payer. Having both benefits can be very helpful if you want access to a wider network of providers or need services the VA does not offer. Medicare might cover specialists or procedures unavailable at the VA. The VA might provide long-term care or mental health services that Medicare does not cover. Remember, neither program acts as a backup for the other. If you see a non-VA provider, Medicare will not pay for services the VA would cover, and vice versa. Always tell your providers about both coverages to avoid surprises with bills. You can enroll in Medicare when you turn 65 or become eligible, even if you already have VA benefits. Having Medicare does not affect your VA eligibility. Each program has its own rules, and qualifying for one does not depend on the other. Some veterans may also qualify for Medicaid, a state and federal program for those with limited income and resources. Medicaid can help pay Medicare premiums, deductibles, and copayments, and may cover additional services like long-term care. But Medicaid eligibility is separate from Medicare and VA benefits and varies by state. To sum up, yes, you can have both Medicare and VA benefits at the same time. Each covers different services and has its own network of providers. They do not coordinate benefits directly, but having both gives you more options for your care. Be sure to inform all your providers about your coverage to avoid billing issues. If you have questions, talking to a Medicare counselor or VA representative can help you understand how to best use both programs.